Uterine fibroid disease, a public health issue and health disparity, presented by Nikki, Collier, East Tennessee State University. Did you know fibroids are not vampires? Uterine fibroids can cause abnormal uterine bleeding, which can lead to anemia. You know, kind of like having the blood sucked right out of you. Now hold on, don't panic. If you were like almost 70% of the female population who suffers from abnormal uterine bleeding caused by uterine fibroids, this video is just for you. What are uterine fibroids? Uterine fibroids are the most common gynecologic tumor. They are benign, non-cancerous growth. They develop from the muscle tissue of the uterus. They're often called leiomyomas or myomas. Uterine fibroid sizes vary. They vary in size from seedlings, undetectable to the human eye, to bulky large masses that enlarge the uterus. Classification of uterine fibroids. Uterine fibroids are classified by their location. There are three classifications: intramucosal, submucosal, and subserosal. Intramucosal, they grow within the muscular wall of the uterus. Submucosal fibroids bulge within the uterine cavity, and subserosal fibroids are found on the outside of the uterus. Some fibroid facts. Even though the pathogenesis of uterine fibroids is unknown, there is evidence that shows estrogen and progesterones enhance the growth of these tumors, as these fibroids rarely appear before the onset of menarche and dwindle at menopause. Fibroids are a major cause of morbidity in women between ages 30 to 40 years old, and the highest incidence of uterine fibroids are found among African American women. Risk factors for uterine fibroids: African American race, age, early menarche, obesity, family history, amount of time since the last delivery, nulliparity, and premenopausal state. Some common complaints of uterine fibroids are notable changes with periods and pelvic pain and pressure. Changes with periods can vary from longer, more frequent, or heavy periods. Pelvic pain and pressure can be described as dull, sharp, or heavy pain during menstruation and intercourse. Pelvic pressure can cause difficulty with urination or frequent urination, constipation, rectal pain or difficult bowel movements, and low back pain. Guidelines and testing for uterine fibroids. There currently are no routine guidelines, as most fibroids are incidental findings found during bimanual exams. The gold standard diagnostic test for uterine fibroids is grayscale ultrasound. MRIs and hysteroscopies can also identify uterine fibroids. Management of uterine fibroids can be addressed conservatively, surgically, or minimal access techniques. Conservative management includes medications such as combined oral contraceptives, progestin-releasing IUDs, gonadotropin-releasing agonists such as Lupron, and most recently progesterone receptor modulators and aromatase inhibitors. Invasive management for those who are symptomatic include uterine artery embolization, hysterectomy, or myomectomy. The management of uterine fibroids solely depends on the woman's desire to preserve fertility. Uterine fibroids can cause distress and discomfort, leading to a decrease in one's quality of life. They pose a health disparity by affecting 1 in 4 women of reproductive age in the United States, with the highest prevalence found in African American women. Fibroids also pose a disparity in research funding and therapies, since access to most therapies are directly affected by the cost of the procedure and insurance approval. There needs to be increased awareness raised about uterine fibroids and a need to advocate for more research and therapy options for those suffering from uterine fibroids. Now do you see how uterine fibroids can be compared to vampires? With all the notable changes in periods, having longer, more frequent, or heavy periods, with painful cramping and pain in the lower abdomen and pelvis, one would feel like the life has been sucked right out of them. Listed below are the references used as resources for the information provided in this video. I hope you found this video to be very fun and informative.